is Officer Ashley Horvath, and I am with Meridian Police Department's Crisis Intervention Team. Today we're here at Imagine by Northpointe with...
My name is Dan Griffin. I'm the Corporate Director of the program.
Well, thanks for being here with us today, Dan. We're just super excited to share about your program and the different types of services you have to offer to our youth. So let's go ahead and get started with what is the most important thing that a person should know about your program?
It's a good question. I think the most important thing that people are always kind of shocked when I tell them is that we are essentially a one-stop shop for clientele. We have counseling, our program is based around group therapy, it's 30 hours a week. So we have a staff of counselors, we have educators, we help provide schooling to kids who are in our program. And we try to just and we also have a nurse on staff, so we try to wrap around as many needs as possible to really help with mental health stabilization. And
Awesome.
We were developed to help stabilize suicidal thinking and behavior, self-harming behavior, an assortment of mental health conditions and just behavioral struggles in general.
That's awesome. And what is the overall mission of your organization?
The mission of Northpointe is to save lives and restore relationships.
That's awesome. Why do you think the Valley has seen an increase in the need for mental health services?
I think that, I think COVID is probably the, one of the single greatest factors for why we've seen that. I read some research about how people struggling with anxiety disorders benefited from stay-at-home, kind of quarantine orders, and people with depressive struggles got worse because they couldn't engage. And then as we went back and kind of assumed those orders were kind of lifted, people with anxiety disorders then suffered more as well. So we've kind of just seen this kind of unprecedented need for specific mental health conditions at different times that, I think that most of the world actually wasn't really prepared to, intervene with.
For sure. What advice would you give to parents in trying to figure out how to help their children?
I think, and saying this with respect, parents trying to help their children, it's really important to see the struggles as a systems issue. And when I say that, I mean, though the child, oftentimes, we treat children ages 12 to 17, and so children are learning to take responsibility for their actions, but it also helps to understand the origins of the struggles in the first place. And we don't necessarily, you can't be successful in doing that just by having interactions with the child. The entire family and the parents are a part of that. And so I think it's important for parents trying to get help for their children to understand that more success happens when they willingly throw themselves into the conversation as well.
And I think that's a super important piece. I know that individuals, we've referred plenty of our community citizens to you guys, and I know that not just hearing from the kids themselves or the adolescents themselves, but from parents as well, how much they feel that your program has benefited not only their child, but their family as a whole.
Right.
So I really thank you for taking the time to sit down with me and talk about that.
Awesome, my pleasure.
If someone wants more information or is interested in admitting their child, what phone number can they call?
We have a phone number for our admissions line. It's 208-369-9937. They're there, around the clock, 24/7 essentially. And then they can help direct, insurance questions, availability questions, location questions, all that kind of stuff for treatment.
Perfect. Well, thank you so much. I really appreciate it.
Thank you.